This is a short video for home injury care, whether it be for an animal or a person, involving vitamin C, colloidal silver, and non-adhesive pads to put over the wound. I'm going to simply show how to mix the vitamin C with the water. This is sodium ascorbate. It's buffered. It's a bicarbonate with the ascorbic acid. It's mixed with the water. This is 8 ounces of regular tap water. Distilled water is all right. This is a syringe. For the wound, the vitamin C can be used as a wash. It is squirted into the wound to wash it out. Never use alcohol directly in the injury, and never use hydrogen peroxide if it's more than a scratch, because hydrogen peroxide kills not only bacteria but also living tissue. And when it kills living tissue, it gives a medium for anaerobic bacteria, which live on dead tissue. So you can complicate matters by giving yourself tetanus by cleaning a wound with hydrogen peroxide. So do not use hydrogen peroxide. Sodium ascorbate as a wash. Gently clean the wound with gauze or even a non-stick Telfa pad or one of these pads to clean out the wound. Wash it again. And then colloidal silver is anti-infective without being harmful to the tissue. This is 500 parts per million. This is 10 parts per million. I would never recommend 500 parts per million internally, but for a topical on an injury, this works well. What you might have trouble finding is a bottle with a spray top, so you can always take one of the smaller bottles and put the put the stronger parts per million into this bottle, or you can get yourself a spray bottle and just empty this into here and then mark it what it is, what strength, and then use it topically. After you've washed the wound, use this topically as a spray in the wound to clean it out. Just put the colloidal silver in there. That will kill any bacteria without killing living flesh. It will not harm you. It will not turn you blue. Then this is lipospheric vitamin C, which is transdermal. This can then be applied directly in the wound. This gel can be applied in the wound. It's a phospholipid, so it's totally compatible with the cells in the vitamin C, which is antioxidative, and also the basis of collagen. So for wound care, it is unparalleled because collagen is the basis of skin. So I also would encourage persons to put in their diet cod liver oil, which has vitamin A and D in it for skin production. So let's go through this again. Here's the syringe. The vitamin C, 1 teaspoon, which is about 5 grams, put into 8 ounces of regular water, stirred, used with a syringe to syringe out the wound. Then application of colloidal silver sprayed into the wound, at 500 parts per million. You might have to get yourself a spray bottle because this comes with a dropper, so consider that. And then, after the gel has been put on the wound, in the wound, this is important, it's in the wound, then, depending on the size of the wound, a non-stick pad is put over it. We don't want anything sticking to the skin as we're trying to heal it. We don't want to rip off with adhesive new layers of skin. So again, keep in mind, no adhesive tape, no alcohol. Alcohol also dries the skin and makes it brittle, and it hampers the healing and keeps the skin largely dried out rather than moist and healing from within. So no alcohol, no hydrogen peroxide. Change the wound dressings once a day, and it works. I've used it on not only myself, but also on animals to bring them back from deep puncture wounds and absolutely wounds to the bone, and they've healed. And this is something anyone can do. Do not forget that antibiotics and seeking a doctor's help is also important. So what I'm showing you here is not to the exclusion of a qualified physician or taking an antibiotic. Vitamin C is an adjuvant to antibiotics if necessary. But it acts also as an antibiotic, and that it's antioxidative, and so does colloidal silver. So in the wound itself, use these items, and then perhaps, all I can say is perhaps, it's up to your own discretion to go to a physician and take antibiotics orally. Okay, that's that.